Nelson, and good morning, everyone. Thanks for taking the time to join us this morning. We have a number of community leaders here joining the conversation. We wanted to provide an opportunity to update the community and the press with regard to the situation we find ourselves in as the pandemic drags on. And you'll hear some facts and figures that are challenging for the community, and part of this conversation today is a call for action. We cannot do this alone. We need community members to step up. Not that you haven't already, but we need more help than we've had. And I recognize that this thing is really tiresome. But the fact of the matter is that we are in a worse position today with regard to hospital capacity and the stress and strain put on the healthcare workers, the women and men who are in the business of saving lives and easing suffering. They need our help. There are two things that are critical. One is, if you have not been vaccinated, please get vaccinated. That is the single most effective way for us to ensure the safety of our friends and neighbors and family members, and to relieve that stress on hospitals. The shots are free. The jabs, as the Brits say, don't cost a thing. They will protect you. They will protect your loved ones, and they will make a huge difference as we move forward. I cannot. I would resort to begging to ask you to get vaccinated. It makes such a difference. You'll hear about the stresses on community facilities here shortly, but again, that vaccine is very helpful. The other things that we did at the beginning of this pandemic that made a huge difference and helped us back in the days when we were talking about flattening the curve, do those things again. Wash your hands, wear masks. We cannot order you to wear a mask. And even if we could, frankly, we got to rely on the goodwill and good nature of human beings to do the right thing. So mask mandate or no mask mandate, please wear a mask, please protect yourself, and please protect others. We have, as of this morning, some good news. We are getting help from the Montana National Guard. Those resources will be deployed here over the course of next week, which will help provide some relief. That is a group effort. We are working with within local government, the our city county health department, our partner institutions at St. Pat's and Community, and Partnership Healthcare. We have reopened the Sleepy Inn, which is our non-congregate shelter. As some of you will recall, we opened that to ensure that folks who were unhoused and had COVID symptoms or actually had the virus were off the street and not spreading that virus. That facility is reopened and staffed by emergency services personnel. Our hope was that we would be done with that facility, but we are not. And it's open, and we may need to open other facilities in order to deal with the increasing number of patients. With that, I would like to pass this along to our health director, Deshane Barnett, among the folks here on the front lines as we continue to fight this thing. Deshane.
Okay, good morning, everybody. So I know the health department put out a press release yesterday letting folks know that unfortunately we broke 2 COVID records that we did not want to break. The number of hospitalizations has now surpassed our record since the beginning of COVID, as has our average daily incidence rates. Both of those numbers are higher and are continuously now rivaling what we saw from last November during the spike. So not where we want to be. Of the roughly 1,200 cases currently active cases of COVID, we know that almost 20% are in children, largely who are under the age of 20, so 0 to 19 years old. And then another 20% are in those individuals who are between 20 and 29 years old. And those numbers closely reflect the vaccine rates. So right now, only 47% of individuals 20 to 29 years of age are fully vaccinated, compared to 56% of our total eligible population here in Missoula. And the really unfortunate thing is not just that young people are getting sick, but with the Delta variant, what we're seeing is that they are getting much sicker. And so when we look back in November of 2020, we had 36 hospitalizations due to COVID, or with COVID as a contributing factor. Over the last month, that same number is now 76. And over the last month, 70% of those hospitalizations have been among unvaccinated individuals. And as the health officer, I get asked a lot about, mandates. Why are we not doing more to put mandates in place to limit the spread of this virus? What I would say is that now is the time when we would have mandates in place. Things like, mask requirements, limiting event size. Unfortunately, we have anti-health state legislators who went out of their way to make that not possible. So I know that a lot of folks are really frustrated that the health officer is not putting in a mask requirement, is not limiting event sizes. And unfortunately, a lot of actions to mitigate COVID-19 have been taken out of our hands here in Missoula. And I know that, we're going to hear from the hospitals and the schools today, so I want to really save time for them. But I want to close my portion by saying that all of the behaviors, the risk mitigation behaviors that we've learned over the last 18 months are still effective. Wearing masks, social distancing, limit our circles to, 10 or less. The big difference between last fall and right now when it comes to contact tracing is that last fall, people were keeping their circles very small. So when we had a positive case, our case investigators and contact tracers had to call, a handful of close contacts. In the last month, we've had one single case that had more than 100 close contacts. That's burdening our system. Anything that we can do to reduce our circles, specifically try to limit our circles to 10 or less, that makes it, if somebody does catch this virus, there's much less work to try to keep that virus from spreading. And we know that our hospital systems are overwhelmed at the moment. And as a community, anything we can do to keep ourselves out of the emergency room is helpful. So not just those mitigation behaviors that I just mentioned, but just in general. Now is not the time to be out there doing, extreme physical challenges or pushing yourself beyond your limits if you have, a pre-existing condition. Instead, now is the time for us as a community to use caution, to use restraint, and to let our hospital staff do the work that needs to be done around COVID-19 without adding additional complications and burdens.
Thank you, Deshane. Joyce Dombrowski is the Chief Executive Officer at Providence St. Patrick Hospital. Joyce, thank you for joining us today.
Yes, thanks, Mayor Engen and all for providing this opportunity. I honestly couldn't say it better than Deshane just said. The impact of COVID patients in our hospital today is like something we have never seen. And I will just say to the community, it was about 3 to 4 weeks ago, I called Mayor Engen on a Tuesday afternoon. I said, we need help. Our community does not understand the situation they're putting us in from a sense of dependency on our healthcare system. We've been here 150 years and we intend to be here longer, but we really do need the community's help in staying out of our ER and therefore staying out of our hospital. I will give a couple of data points and then I'll turn it over to Dr. McKay to talk more about the clinical situation. Sorry. As of this morning at St. Pat's, we have 30 inpatients who have COVID. 4 of those are on a ventilator, and of those 30, 23 are unvaccinated. The age of our patients, in fact, is lower, as Jane has already pointed out. Individuals are sick. Our emergency department is absolutely overwhelmed. I think everyone has seen the ambulance bay. And then we had a physician leader in the ER go on social media in midweek this week to really make the same plea. And so I think from a community standpoint, it's really asking, and maybe to use your words, Mary, and begging individuals to get vaccinated, to mask, and really to social distance, to go back to those very basics. We need your help. We are not going to be in the position to provide the same level of care if we can't stop the flow of the COVID patients coming into our organization. And with that, if it's okay, I'll turn it over to Dr. McKay to finish up with our remarks.
Please, Dr. McKay.
Thank you. I'll be quick, Joyce. And Marion and I join you in the begging. That's how St. Pat started. The sisters went on begging tours to pay for this place. So we have a long history of begging. And I would beg the community to think about their family, think about their neighbor, and do those things that are required to help mitigate this problem. I can tell you I was in the ICU today. I talked to a nurse there who has decades of work there, and she said yesterday she could just barely make it into work. She's never seen it like this in decades. I've talked to folks in the ED who are just simply overwhelmed. Joyce mentioned some of the numbers for those 5 vented patients in the ICU. None of them are vaccinated, and we're dealing with a younger age group than we have before in the hospital. We have people in the 20s and 30s in the ICU. I was on a state call earlier today, and there are hospitals across the state that their numbers are down a little bit for COVID today, but they also had like 5 deaths yesterday in some of these hospitals. They're also seeing patients that are in their 20s and 30s dying. So it's that young age group that felt like they weren't affected before. That's not the case with Delta. And I can tell you I'm very proud of the folks that come here every day in the face of what feels like Groundhog Day over and over again to face these challenges. They have the same challenges in their own community, you know, when they're outside the hospital with in terms of their families. We have over 50 caregivers on any day that are out because of COVID exposures, either have COVID and have to isolate or have been exposed and have to quarantine. So I guess I would just say I don't want to take any more time, but just because the mandates aren't there doesn't mean it's not the right thing to do. And so it's going to take a little while getting the vaccine to have an effect. Need to do that, but right now what you can do is you can mask, you can social distance, you can do hand hygiene, you can think about what's right for your family and your friends, because this is not a political issue. Wearing a mask is not a sign of weakness. Wearing a mask is a sign that you care about your friend and your family and your community. And everybody, regardless of their political spectrum, where they land, loves their family and their friends and wants what's best for them. And again, the way to do that is to mask up, social distance, and get the vaccine. And don't listen to the misinformation. Find the facts and do the right thing. Thank you.
Thank you, Dr. McKay. Next from our partners at Community Medical Center, Jim Gilhouse, our Chief Operating Officer.
Yes, hi, good morning, everybody. I will say the surge that we have been seeing in other parts of the country, we are absolutely seeing right here in Missoula and Missoula County, right here in our facility here at CMC. We are recently seeing an incredible increase in our COVID inpatient numbers in our hospital. A couple quick statistics, then I'll turn it over to my colleague, Dr. Nicole Fink. Currently, we have 20 COVID patients in our facility. Approximately 1/3 of our overall adult inpatient census. 85% of our hospitalized COVID patients are unvaccinated. 93% of our ICU COVID patients in our facility are unvaccinated. The trends we are seeing are definitely skewing towards younger patients, and our COVID patients are getting much more sick more quickly. I want to reassure the community the ER is always open. Do not delay essential care. And again, the COVID-19 vaccines truly is our best defense against this pandemic. If you haven't been vaccinated yet, please know it's not too late. Particularly the Delta variant surging in Missoula County and across the country. Now I'll turn it over to Dr. Nicole Fink, our Incident Command Medical Specialist and Pathologist here at CMC.
Dr. Fink.
Thank you, Jim. I'm just going to echo what you've heard my colleagues here in the healthcare community in Missoula say. We are seeing unprecedented increases in hospital volume here in Missoula right now, largely driven by COVID positive patients, the vast majority of whom are actually unvaccinated. These patients are younger, they are sicker, and they are taxing the resources of our healthcare community. Healthcare resources are not unlimited. And as institutions, we are going above and beyond right now, shifting everything we have to take care of the patients that are in our hospitals and to try to keep people also able to get care on an outpatient basis. But we can't do this alone. We desperately, desperately need the help of the citizens that are our neighbors and our friends and our family in this community. So I ask you, please get vaccinated. Please get vaccinated for COVID. Please get vaccinated for the flu. Please wear your masks to decrease the spread of this virus. And please social distance. It's the basics that we've been doing since the beginning of this pandemic. But the vaccine is highly effective at keeping people out of the hospital. So we're doing our part. We ask that the public please does theirs.
Thank you very much. The Executive Director of the Missoula Economic Partnership, Grant Keir. Grant, thanks for joining us.
Thank you, Mayor. And let me just first say thanks to our healthcare professionals. Your efforts are heroic right now and deeply appreciated across the community. Yesterday, Missoula Economic Partnership released our State of the Workforce report. Just about every small family business in our community is struggling right now to find enough employees to keep their doors open. Some aren't keeping the doors open. None of these businesses can afford to lose their staff right now because they're out with COVID, or they're quarantined as a close contact, or they need to stay home because their child is a close contact at school or in daycare. Together, through various relief programs, we've invested hundreds of millions of tax dollars to support our local businesses through COVID. None of us wants to see these businesses close. They really define the character of our communities. But there is no more financial relief for these businesses. And right now, it's really up to all of us and the actions we take to protect that investment and to protect small businesses. For many business owners, we know every hour of operations are critical, but please encourage and support your staff to get vaccinated any way you can. For employees and customers, please do your part. Get the vaccine, wear a mask, and social distance. Right now, many of our businesses are still able to operate because we have the great outdoor spaces to use and it's still warm, but we're just weeks away from a transition in the season. And now is our chance to get ahead of the Delta variant so that as we enter fall and cooler weather, our businesses can stay open and stay in operations, and we can maintain the community character that we all love. Thanks.
Thank you, Grant. And Rob Watson is the superintendent of Missoula County Public Schools. Dr. Watson.
Yep. Good morning, everybody. Thank you for the opportunity just to add a few comments. I would echo Grant's statement about support and for our healthcare workers, which are so critically important right now. I just have some information to share about the school district. I think it's important to note that we are doing our part to mitigate COVID in our schools through face covering requirements and close contact tracing. However, we are a reflection of what's happening in the community, and that's pretty typical of any school system. We're a microcosm of the community, so as cases go up in the community, cases are also going up in terms of students that are impacted at school. This week, we also broke a record. We have 45 so far, 45 cases this week, which is higher than any week we had last year. We also had a number of close contacts last week. 167 students were out last week contact. And that means that we've got kids that are out of school, which impacts their learning, but also impacts the rest of our community when kids are out of school and not able to attend. As Deshane pointed out, the vast majority of the cases we're seeing right now are among students. The majority of our staff did get vaccinated last spring, so we're not seeing as many staff out, but we have a lot of students that are out. If you look at the active cases right now in Missoula County, 18% of the active cases are the ages 0 to 19, which are our kids. So it is impacting kids much more than the last surge we had last year. As of right now, we haven't had to shut down any classrooms or grade levels. However, that's totally dependent on the number of staff we have and number of staff we have that might be out of school, and then the number of kids in a particular class that might have to quarantine. So we hope that we don't have to shut anything down. Our goal is to maintain in-person learning as much as possible this year and keep schools open, but we really could use your help in that. If there are any parents that are listening to this press conference or receiving this information, I just have a couple of pointers and then some things that the community can do to help. For parents, please keep your kids home when they're showing symptoms that they may be sick. We would appreciate it if they stay home and get a test. We have multiple ways to receive a test. We're giving tests in our school district. If you're struggling to find COVID tests, please contact your school. We can make sure that we get you on the list to receive a test. I would also ask parents and community members to cooperate with our directives. Specifically, when you come into our buildings, we're asking that students, staff, and community members wear face coverings while they're in our buildings. That helps keep our staff and students safe. The other thing I would ask parents is that when you are notified that your child might be a close contact, please cooperate with our staff and keep your child at home. The last thing I would say is vaccines. I was encouraged this week where our 15 to 19-year-olds actually surpassed the 20 to 29-year-olds in our community. That means our 15 to 19-year-olds are getting vaccinated, which is encouraging for us because that's a large percentage of the 15 to 19-year-olds are our students. We have a little ways to go on the 12 to 14-year-olds. I think it's 42% of those that have had at least one dose. If you have a child that's over the age of 12, I encourage you to get vaccinated, get your child vaccinated. If you have questions about the vaccine, please reach out to your healthcare provider to talk about it. If you don't have a healthcare provider, please contact our school and talk to one of our school nurses about vaccines. We're encouraging vaccines for any child over the age of 12. We think it really help keep kids in school and keep transmissions down. Thank you.
Thank you, Rob. So, folks, if we want to thrive in this community, we need to take action now. And these actions are very simple. If you want first responders to continue to respond when you are in need, when a loved one is experiencing a crisis, you can help today by getting a vaccine, wearing a mask, and taking precautions. It takes one exposure to one emergency responder to take out 5, 6, 20 first responders. Your actions have consequences, and please remember that, and please do the right thing. Take care of yourselves, take care of your friends and your neighbors. I hate to sound preachy, but this is all about personal responsibility. We hear that over and over again. We hear about freedom. If we're going to have a community that we can continue to enjoy, where people are safe and cared for, we need folks to take the precautions and take the steps necessary to get us closer to normal. And with that, I'd like to turn it over to my colleague and friend, Commissioner Dave Strohmeyer.
Thanks, Mayor Engen, and I'll largely be an exclamation point on everything that's been said thus far. First off, a great big thank you to our Office of Emergency Management, healthcare providers throughout this community, throughout Missoula County, the dedicated folks at the Missoula City County Health Department who have been doing contact tracing, vaccination clinics, and everyone else in the community who has helped mitigate the impacts of COVID-19 over the past year and a half or so. Friends and neighbors, ladies and gentlemen, this is largely a tragedy of our own making. It is so unfortunate that as much progress as we've been making over the past year, that we are in the position we are today. But as the other speakers have said, the science is unambiguous. Getting vaccinated, wearing masks, socially distancing makes a difference. And this is, and I will follow your lead here to some extent, Mayor Engen, in terms of shading into being a bit preachy here. This is a civic responsibility, I believe, to get vaccinated. This is all about caring for one another and our community. As Dr. McKay earlier mentioned, caring for one another. This is the heart of the matter right now. So let us work together as a team and take those precautions such that we don't have to call in the National Guard or find ourselves with such a capacity issue at our healthcare facilities. So with that, I think, Mayor Engen, we would love to hear if anyone has any questions.
Sure would, Commissioner. Thank you. And thank you all.
Yeah, this is Ed O'Brien at Montana Public Radio. Thank you all, excuse me, for this opportunity. St. Pete's in Helena yesterday announced it's in dire straits, has implemented crisis standards of care protocols, rationing healthcare. St. Pat's community, have you all taken various forms of that yet, or are we not quite there? And I have a couple of quick follow-ups too.
Sure. This is Joyce at St. Pat's. We have started that conversation. We've actually been in that conversation for the last couple of weeks. We have to be very clear and careful about what that really then means and what are the implications. And should we make that decision, we have the responsibility to communicate to the community at large what limitations that might put. And Dr. McKay, you as a clinician could probably answer that more specifically, please.
I would say that we're not at that state yet, but we're on the cusp of that state. We're in what we would call contingency, where we're not doing business as normal. We're not to the point yet of actually rationing care, but we are at the point where we are having to limit some of the care that we would do on a normal day. When you really get to that critical state, you're talking about triage. You're talking about having 3 patients and you only have 2 beds, and you have to decide which 2 patients are going to get those beds. And we're not that far away from that. I don't want to scare people, but that's the truth. The other truth is, in a sense, we are already triaging people, because normally community and we, as larger hospitals in the region, take on patients from our outlying critical access hospitals that need our level of care. We're backed up. We've been on what's called diversion for weeks. We have patients that need our care in some of these surrounding areas, and we can't bring them in here because we don't have room. So while we don't call that triage, in fact, it really is. And then the other thing is, those hospitals, again, where many of us come from, they are calling desperately around the state and around the whole region, sometimes up to 20 hospitals, to try and find a bed for their sick person that they can't really care for with their resources. So we're kind of already there. We haven't called crisis standards of care. That is a big step to do that, but do not underestimate the fact that we're not providing the optimal care now because of these numbers. We're doing everything we can to do it, but that's the truth.
Mayor, the National Guard, how many, where are they deployed, what are they doing, or will they next week be deployed, et cetera?
Ed, I'll defer to Adrian. We just got word this morning that the Guard would be available to us beginning next week, and Adrian and her team, in collaboration with the folks at this conference today, made that request. So, Ms. Beck.
Thank you, Mr. Mayor, and thank you, Ed. So we did put a request in this morning for 24 National Guard resources deployed to Missoula County. The needs are obviously with the hospitals, as you've heard. They have staffing shortages that Guard resources can be deployed for. But we also expect to have needs within our isolation and quarantine facility at the Sleepy Inn, as we expect to see an increased capacity there. And so right now we are planning to deploy the Guard under the direction of an incident management team being fielded out of the Emergency Operations Center so that we can have a coordinated community-wide approach and utilize those resources to their best ability and greatest need.
Thanks, Adrian. You said 24 then, just so I'm sure.
Correct. That was the request.
That's a lot. That's got to be helpful. Final question, I'll close my mouth. Mr. Mayor, you mentioned the possibility of opening more facilities. Do you have any details there?
Ed, the only thing that we have discussed to date is if we end up having overflow in non-congregate shelter, that is the Sleepy Inn, there's potential for using other municipal facilities, including Johnson Street. And I will tell you that the leaders on this call have we're considering all possibilities at this point, and we've had conversations about at some point, if necessary, deploying field hospital units to deal with overflow. Our biggest challenge today is less about facility and more about staffing. We need humans with skill to manage all of the moving parts here. So those Guard resources will certainly be welcome and helpful.
Much obliged. Thank you all very much.
Thanks, Ed. Martin.
Yes, good morning. Try to think of an articulate way to phrase my question, but Mr. Watson suggested that anti-health state legislatures went out of their way to make public safety protocols impossible. Legislation, I suppose, can change if things get bad, and given the situation around the state and here in Missoula reaching crisis level and the concerns of the hospitals, I'm wondering if any of the people who have had conversations with the state have gotten any kind of possible insight of any change of mind on the state's approach to the current crisis.
Just want to make sure that we've got attribution right. That was Deshane Barnett, our health director, rather than Dr. Watson.
Thank you.
Rob can get in trouble on his own. Martin, I don't have any of those insights. I do know that a number of jurisdictions, including our own, are considering seeking some sort of court relief so that we can have local control over these very challenging local problems. The kind of control that we had prior to the last legislative session, the kind of control that many of these legislators who limited our control say they want from the federal government. I take an irony pill every morning to get through the day, and I've had to double my dose of late in order to reconcile some of the cognitive dissonance that I've seen come from the legislature. So we're leaning into it, and others on the call may have some perspective as well. I know that the Montana Hospital Association is in pretty constant contact with the governor's office. I know Commissioner Strohmeyer reached out to the governor last night. I reached out to the governor a couple of weeks ago with regard to emergency declaration and potential for National Guard resources. So we're keeping all those doors open, but until the legislature meets again, or a court takes action, we are constrained by the law of the land today.
Thank you.
Along those lines, Dennis Bragg at KPAX, Deshane, one thing that nobody has talked about, and last year, a year ago especially, was the response from churches. And I realize there's not that legal aspect of things about large gatherings, but any appeal to churches or other social kind of gatherings to maybe show restraint or go back to where they are, would that be helpful?
Yeah, I mean, so I am a member of a church here in Missoula, and well, actually out in Bonner. But as a church community, there absolutely are things that we can do to keep each other safe. And so, those include holding services outdoors when it's possible, if the weather cooperates. The social distancing. Our church has now, gone so that we're live streaming services so that people can watch from the safety of their homes. Wearing masks, having congregants not sing, because we do know that when you sing, you expel more droplets and aerosol. And so there are things that we can all do to keep each other safe. And especially in our faith communities, if we have, I know the church that I go to, we have a lot of elderly people there. I would hate to be the one responsible for bringing that into our congregation and harming the older folks. And what we are seeing with the Delta variant, because it is stronger, is that those individuals who are fully vaccinated and are ending up in the hospital are older. And so I want to protect my neighbors and congregants who are older, who have been responsible, gotten fully vaccinated, but still we're dealing with a very transmissible variant of this virus.
Thank you. And one other question on that, and then maybe from Commissioner Strohmeyer, when you go out to the smaller areas, is out in Sanders County, and certainly there's a lot of concern about their case rate and their proximity to North Idaho. Is anybody reaching out to the other health departments or the other county commissioners in the surrounding areas to maybe kind of extend this message outside of Missoula?
I'll speak first from the health department. Yes, absolutely. So we talk to the other health officers regularly. The urban health officers in Montana, we have a separate call, but then we also, all of the health officers, we talk. And yes, this is something that all of the messages about the situation with our hospital system here in Missoula being strained, we get that out to our surrounding counties, because those individuals are going to be impacted when they're looking, just like our hospitals mentioned, when they're looking for critical care that's only provided, a level of care that's only provided here in Missoula, and that care is now being put off of the table. That impacts our surrounding communities. From the health department side, yes, we absolutely are communicating and coordinating with other health departments. And then I'll let Commissioner Strohmeyer talk about the commissioners.
Yeah, here in about a week and a half, I'll be meeting with other commissioners around the state by way of the Montana Association of Counties, and comparing notes with particularly the other urban counties that are more comparable in demographic and population as Missoula County. I think we're all struggling with the same issues, whether you're in Flathead County or whether you're in Yellowstone County. We have a tough row to hoe right now, and I don't have any clear answers from what other counties have experienced in terms of success stories, but we'll certainly be comparing notes.
Thank you.
Other questions today?
Yeah, my name is Mackenzie Quinn, NBC Montana. I have a quick point of clarification question over at St. Pat's. It was mentioned that 4 were on ventilators, and then Dr. McKay said that 5 were on ventilators. Can we just have that number corrected?
Sure, Dr. McKay. I said 4 and you said 5, and you might have the most recent information.
I would just tell you that it changes from hour to hour. So
it might have changed, yeah.
Concentrating on just a single number like that kind of, but kind of misses the point, because it really is variable and it just changes hour to hour. It's a constant flex. So it might have been 4 this morning. I think it might be 5 now. So that's the reality. It's very fluid.
Thank you.
Other questions this morning?
I just want to say, I think the key point there is none of those people that are vented are vaccinated.
Yeah, Jordan Hansen with Missoulian. I'll hop in here for a second. This is more of a question for the medical professionals on this call. I was curious if, are people coming out, are people coming to the hospital and finding that they do have COVID testing positive there, or is it more they've already tested positive and had their symptoms, get worse? I was just curious if that was kind of the case, or what exactly.
So I think that we're seeing both is the answer. Many of the people that present to the ER have symptoms, and this variant presents with a wide variety of symptoms. So many people come to the ER presenting with GI symptoms, nausea, vomiting. Some people present with shortness of breath, but this variant, this virus is incredibly insidious, and it is a master of disguise, and it can present in a lot of different ways. So some people present to the ER knowing that they were diagnosed with COVID and have been getting progressively sicker at home, and other people present not even suspecting that they're infected with COVID, and then it turns out that their underlying symptoms are indeed secondary to the virus.
Thank you.
This is Peter Christian from KGBO.
Hey, Peter.
Yes, I'm having a pretty good bird's eye view of the Grizzly football games. Right up there in the booth. There were 25,000 people in Washington Grizzly Stadium, and I would say maybe less than 1% were wearing masks. I was wondering if there's been any numbers coming back from that particular event, especially as we're heading into homecoming, with a lot more folks coming into Missoula. Thank you.
Thanks, Peter. And I'll let medical professionals take that. I also note that I think Paula Short from UM is on our call today, and she may want to speak on behalf of the University of Montana.
I'll let her go first.
Paula, did you want to chime in? And maybe you're no longer here, Paula. I saw your name earlier. All right, Doc, back to you.
Nicole, you want to take this one, or shall I start? I'll start. Yeah, this is more my opinion. You know, we certainly are all striving to get back to normal, and you know, lots of excitement, and it's really important for the community to have that event. I don't know what the right answer is in terms of, you know, saying we shouldn't be doing that. It is outdoors. We know that is, safer. At the same time, to have that much crowding for that period of time with people yelling and shouting, you know that that's a place where the virus can spread. So we're trying to understand and be sensitive to everything involved. From my perspective, there's still things you can do. You can go to a Grizz game and you can still do things to be careful. You can still mask. I saw the TV show, you know, the TV footage as well, and I saw how few masks were in place. So in an ideal world, I don't think we'd be having these kind of events, because back when we thought it was going to get this bad, we stopped doing them. And now that it's this bad, we're continuing to do them. So there's this major discrepancy, and it's a very difficult, challenging issue. But people could still do more. And Nicole, I don't know what you might have to add.
Yeah, I would agree, and certainly it's my opinion, but it's science as well. While outdoor activities are certainly safer than indoor activities, anytime that you are in close proximity to others, particularly if you're yelling, you're screaming, in excitement, you're cheering on your team, which we all desperately want to do right now. We really do want to get back to normal. And I think that's what is actually ultimately so disheartening, the fact that we are in this position and even having this conference right now and having to talk about this. If you're going to do those things, then try to do them as safely as you possibly can, and wear a mask, try to stay distanced. And if you can't do those things, then perhaps consider not doing them at all, so that we can maybe in the future, at this time next year, be doing it and not be having this conference to tell you to be cautious at the same time that you were doing those things.
Yeah, in the ideal world, we wouldn't be doing it now, but we're not living in the ideal world.
Yep. There's nothing ideal about what's going on right now.
Jordan Hanson with Missoula again. I was kind of curious about one other thing. More capacity. I know that some areas, have resorted to, using refrigerated trucks and things along those lines. And I hate to be morbid, but I did want to ask that question.
So as healthcare institutions, we actually do have crisis plans. that we evaluate and go over that we hope that we'll never have to enact. Hopefully we will never see refrigerated trucks here in Missoula housing bodies, but you don't know. We have those emergency plans in place as institutions and as a community, should they need to be enacted.
Any further questions today?
I just have one more follow-up, and I don't know, I'll throw this out to whomever, but it seems like the thrust of what we're talking about here is a lot of repeat vaccinations, but the thing that keeps coming up is reaching those younger adults. How do you sell that? Has anybody got any ideas to, put that emphasis more and try to reach out in different ways to especially those 20 to 29s or maybe in older teens that could be vaccinated?
You bet. Well, we had a conversation yesterday about paying people to get vaccinated, Dennis, and we haven't refined all of that yet, but that's certainly a piece of the puzzle. And Deshane and his team are doing their best to reach out. Deshane, go ahead.
Yeah, I was just going to say, I mean, this is the pandemic and especially the Delta spike have now led to where I know what TikTok is. So we have absolutely moved on to these platforms. So the health department, we're putting messaging out on TikTok. We're putting messaging out on Instagram Reels to reach that younger population. We're, pulling, the medical experts, the infectious disease docs, and getting them and the ER nurses and getting them to really share, the situation where we're at and the fact that vaccines are effective, the fact that we don't have to be in the position that we're in. And honestly, I'm open to any and all suggestions for how we reach that younger age group. I mean, I think by my hair, the gray on the side, you can tell at 45, I don't know what's cool for a 19 or 20-year-old anymore, but we need these 20, 22, 25-year-olds to get in and get vaccinated. We absolutely do.
Thank you.
And Deshane has largely been relying on me, Dennis, to understand what's cool. So
the offer of help is much appreciated, I'm sure.
Dennis, this is Joyce Dombrowski. I just want to add, I did have a conversation with President Bodner yesterday, and I don't have all the specifics, but he's well aware that his university has that number of people and very, very committed to giving and putting vaccines in every place they can. And again, I can't speak for the university, but his sensibility and his focus on that I think is tremendous. And I think if there's additional information that we can get from the university that would be helpful, I'm sure they'd be happy to share that with you.
Thank you.
Further questions this morning? So I would simply ask that our media partners, we brought you here today to help us spread the word. I'm grateful for your participation, for the participation of all the folks who are on this call this morning. Everyone is leaning into this, and particularly our healthcare team. They're exhausted, but they keep showing up to ensure that the community stays safe. So you've heard it over and over today, and we'll say it one more time. Vaccines work. Social distancing works. Masks work. Those protocols work, and we need your help. And with that, if there's nothing else, I will simply say thank you again. We will get through this, but we'll get through it a hell of a lot faster if we work together and put some self-interest aside and think about the broader community. We are absolutely in this together. And in some cases, folks may not like that, but it's a fact. So let's do what we can as a community to help one another, please. And with that, thank you again. I feel like saying we'll be adjourned, but that's not what this is. All right.
Thanks, everyone. Appreciate you helping to get the word out. Thank you.